Hi, everybody. Thank you so much for tuning in. My name is Dr. Stephanie Warner. I'm a naturopathic doctor and acupuncturist. I'm here to share with you some of my knowledge and hope to empower you to better understand your body and your health and to help guide you in where to look for improving your health and your wellness. And hopefully share a little bit more with you about what naturopathic doctors do, what Chinese medicine practitioners do, and how we're a little bit different than conventional medical doctors or conventional care that maybe you've experienced. So yeah, welcome to my first video. And I'm sure there's only improvement from here, so please forgive me if things get a little funny. So my first topic of my video today is going to be on parasites. It's an interesting one, and I'll tell you why I'm doing a video on parasites. So I'm seeing parasites discussions all over Instagram, all over YouTube, and TikTok right now. And I have a lot of experience and personal interest in parasites, and I wanted to share some of that with you. So hopefully you can share it with others, as well as, to point you in the right direction and help you sort out whether or not you think you may. Because I have some personal experience with parasites, and I wanted to share that with you because I didn't get the help that I needed in real time, and I had to figure out what was going on with my body. So I wanted to share that with you so that you can, help yourself share this with others as well. So for parasites, I guess the question or what leads one to have parasites. So there's some circumstances in which I think set us up for it. And so this one's going to be a really common one. This is on sushi. Many of us eat sushi at least once a week, once a month. I know some people once a day. So some of this raw sushi we're consuming is having some parasites on it. I know that we're told that it's, flash frozen at the ocean side or seaside, and all parasites should be mitigated with that, but unfortunately that's not always happening, and I'm finding that we're still getting parasites on sushi. And parasite content on fish has gone up in recent years, and I believe that this is due to the ocean health and the care of our sea creatures. So sushi, that's one. Raw fish, or eating raw meat, potentially, especially pork. Raw pork carries tapeworms. Okay, next, camping or fishing, or being around a lot of river water. There's a parasite called Giardia that lives a lot in river water. There's flukes as well. Those can live in river water. So even just, washing dishes or, drinking the occasional bit of river water or some getting in your mouth if you're in the river, that small amount is just enough, which leads me into international travel. So it doesn't necessarily mean a specific location, but, going to Europe, going to South America, going to Mexico, going to Southeast Asia, etc., or even here in North America, we all have parasites as well. Africa, I don't think that there's a region on this planet that doesn't have some sort of critter. But one of the key things that kind of makes me start wondering is if this person that I'm meeting remembers an event while traveling. Oh, I, went to this country and I had, vomiting or diarrhea or fevers and I got really sick. So that's one factor, and a memory of an acute event. Because sometimes when we do ingest these guys, we do have this really strong initial reaction. So that's one factor. My friend in Bali, she calls it Bali belly as well. So yeah, there's definitely signs and symptoms associated with international travel. So that leads me to discuss some signs in our body that kind of suggest we might have a parasite. So I am under the impression that, often when we get exposed to a parasite, there can be a dramatic showing of this, right? Fever, chills, vomiting, diarrhea, bloating, just feeling unwell, fatigued. But I also think that sometimes our body can't fully resolve these infections on our own, and it can be a low grade for a long period of time and impact us. And so some of the key signs of experiencing a parasite is unintentional weight loss or just losing weight over months. Because the parasites are stealing your nutrition potentially. So weight loss is a key sign. And then because it's stealing your nutrition, having low minerals as well will be a result. So that could be, finding low iron on blood work or B12 or calcium, magnesium, and then a sign of this showing up in our body is like kind of muscle twitching. Sometimes we get muscle twitches and stuff when we're low in some of these minerals. And then additionally, my favorite symptom, which is the vaguest one of all, is just fatigue and exhaustion. Having these parasite critters in us can make us feel tired and fatigue over the long haul or long term. So unexplained fatigue is a sign and symptom. Of course, any plethora of digestive symptoms, right? Chronic diarrhea or bloating or just not doing well, constipation. Poor hair and nail quality. And this is largely because of the minerals that they're stealing from us or interfering with our absorption. Having poor hair and nail quality can definitely be a sign and symptom as well. The next two I want to talk about are my favorite two, which are kind of like ding, ding, dings. One of them is teeth grinding your teeth at night. Certainly many of us, do teeth grinding from stress reasons, but additionally, another main reason can be parasites because they are a lot more active at night in our bodies. And then my other favorite key leading symptom that's a little more obvious is having an itchy butt. There's a couple other explanations, but that is one of them that kind of leads me to think about parasites. Two more that I kind of came to mind was just like insatiable hunger, eating a full meal and feeling hungry shortly after, or also getting intense sugar cravings. It's them kind of wanting the sugar cravings and or worsening of your digestive symptoms or any of the symptoms or signs that I just listed after sugar, because they do love sugar. So those are some of the key signs that kind of make me wonder, does this person have parasites? And another thing that very few of my clients come into the clinic with, but one observation that I noticed personally, and you can read about, is that the parasites are really active with the moon cycle. So it's not uncommon to notice more activity around the full moon and or the new moon of these parasites, because that's just that's just the replication cycle that they're on. It's a little bit longer. It's not like bacteria, which seems to grow after 3 days kind of thing. It's more of a 2-week type cycle. I just thought of another sign and symptom is skin reactions, histamine reactions, just getting hives after meals, or just, reacting really strongly to foods, getting rashes as well. So those are kind of some of the ones that I'm just listing off the top of my head here. Another finding, if your hormones are constantly disruptive, low cortisol or estrogen or testosterone or whatever, like if your sex hormones, cortisol hormones, thyroid hormones, parasites can definitely be the causative factor behind some of that. So it's always good to work with somebody that kind of, can point that together. It's one thing to kind of fix your hormones with a supplement or a prescription, but sometimes, at the heart of this is a chronic infection that we've got to get rid of to kind of get people well. In terms of just a few diseases or things to think about for parasites, Of course, like any digestive symptom, liver disease, some of the flukes hang out in your liver. So getting a diagnosis of some liver concerns can, I mean, it could be a fluke. Additionally, having bladder cancer, that can, like, there's studies, I've found them. There's studies out there that sometimes at the heart of bladder cancer can be a parasite, right? Creating chronic damage. It can create chronic damage of any tissue, really. And then, of course, autoimmune disease. This is obviously, there's so many conditions that fall under the autoimmune disease. But any chronic infection, it's often linked. Chronic infections can cause autoimmune disease. So if I meet somebody with, chronic fatigue syndrome, not an autoimmune disease, but arthritis, thyroid issues, musculoskeletal arthritis conditions, lupus, any sort, some of these neurological conditions as well, can also be implicated with parasites. And then, of course, my favorite one that I learned about in school from my teacher, Dr. Heiner Fruhoff, was called rat lungworm disease. Is a disease that affects the brain, and it's largely found in Hawaii. So anyways, that's a different one. And the presentation of that one is neurologic, like it kind of appears like MS type because it affects the brain. So the question is, what do? You want to work with a provider that can potentially collaborate and pick up on some of these signs and symptoms. I will share with you that, there are parasite tests. The best ones are in which you collect multiple samples, just due to capturing the parasite life cycle. So I think if you're inclined to test yourself for parasites, you want to work with a provider that offers this testing and knows what to do. Bear in mind, many of these labs test for just particular parasites, so a lot of it can get missed. And I'll just share with you, in my experience, I often don't do parasite testing as much anymore because I wasn't finding reliable results. I was getting a lot of negatives when I was convinced that this person should be a positive. So one of the things that I do now is I just engage with treatment right away, which, saves some of the cost of lab testing, and then it allows people just to spend more time on the treatment practices. So of course, there's pharmaceuticals out there. If you're going to treat yourself with a pharmaceutical, it's probably wise to know what parasite you're dealing with. Of course, you'd want to get the test. Additionally, in my practice, what's unique and different about me is I use a lot of Chinese herbalism to conquer these critters. So that's kind of one of my expertise in that area, working with the parasites. And in terms of treatment trajectory, everybody's different. It's amazing how long they linger for, but certainly if you're struggling with parasites, it's best to find a provider that you can work with, that you trust, that's done this before, and can collaborate with you in the treatment of it. Anyways, I thank you for watching my video. I will be creating some more content for you, but I just wanted to kind of speak about parasites first, just because it was a topic of discussion and people are finding me for it. And I just wanted to share a little bit more information of my thinking behind it. Anyways, thank you so much, and we'll see you again soon.